So the movement is one of the keys to being healthy and helping us to change the pain syndrome. If all you can get out and do is walk to the mailbox and back to the house, you've started to engage a change. But it hurts so badly. You're right. So you need to move. All I can do is sit. If I sit, it hurts. You're right. You need to move. Okay? So we have to encourage movement to get these pathways firing faster than these little old dirt roads that just keep moving to brain. Okay? So, yeah, great question, Hugh. And that's oft where we have to be looking then is, has there been a change in my ambulation, my ability to move, to walk, because of a surgery? Is there a pain threshold now that has become closer to summation that doesn't take much for it to fire? Okay? Remember when you had that knee surgery or that arm surgery or whatever the case may be, and now just even the water in the shower running on it, feels so uncomfortable. Okay? It didn't used to feel that way. It used to be I could play football and get hit in the arm with a helmet, and it's like, oh, there's a bruise. Now just the water in the showers. Gotta hide that, put a washcloth over it to protect it. Okay? So if we can change that pain threshold and summation, the awareness in this area of the brain, then we can really start to make some big changes in the body. Okay?
How would you change the
Brain perception?
Yeah.
So again, left-sided stimulation may be the case. It depends on the person. Okay? Sometimes a green light stimulation from that side. Sometimes it may be just activating the brain by choosing targets and then just bringing that target back to a stimulation from one side to the other. It may be using some glasses that are blue and red lenses. It just depends. Okay? Because each person's brain is going to be firing at a different summation or frequency of firing. We want to base the treatment on what they can tolerate. Okay? So one person comes in, they're in a wheelchair, somebody's bringing them in, versus the other one who says, I can still fight through this. I go and fish and ride my mountain bike and I still have these syndromes. We're going to treat them a little bit differently, right? So it just depends. But those are some of the ways that we treat it. Okay, great question. Any other questions this evening? Chronic fatigue?
I was just talking to my brother, and he is getting
neuropathies.
Is that associated with the brain, or what is the cause of that?
Okay, so let's look at this question because it's important to answer. The question is it neuropathy typically going to be in this category of chronic fatigue syndrome and fibromyalgia? The answer, for a true neuropathy, most neuropathies are caused by some type of a blood sugar imbalance, typically secondary to diabetes. Okay, so diabetic neuropathies are very, very common. A peripheral neuropathy, most often we'll look at due to an imbalance in blood sugar. What happens in the small vessels in the periphery is in the capillaries, the insulin and the sugar is not able to be invited into the cell by insulin to be burned off, so the sugar continues to circulate and becomes a sugar alcohol. A sugar alcohol becomes very toxic to the nerve endings, and consequently that sugar alcohol starts to escape the capillaries and creates a toxicity at the nerve endings, and so now I start to feel this neuropathic pain, okay, or neuropathology or neuropathy.
It's really not associated with this at all.
Not truly, okay, it's typically different. However, blood sugar imbalance may lead to that, and a neuropathy may be associated with some type of a fibromyalgia, but it's more often associated with a different type of pain. Okay, a neuropathy usually will be a very stingy, burny type of a sensation, whereas most of the people with fibromyalgia will describe more of an ache. It's just deep. It's just this nagging pain. So there's kind of a differentiation. Usually a neuropathy is more of a nerve-related neuropathology. Okay? But it may be in the same family, meaning it could potentially lead to or be precipitated from. So a person may have already had some of these tender points in their body, fibromyalgia. They may have felt fatigued, and it may be that they have diabetes and now they're getting a neuropathy. Okay?
Once you identify the right cause of these sort of problems, typically across the board, how quickly do they respond to treatment?
So the question next is, how quickly do most people respond to a treatment? And again, one lady, it was just the specific brain exercise, she leaned forward and she can touch her toes. That's after many years, okay? In her case, how many years had she had this? Hers was over 8 years that she'd had this intense pain. So it was immediate, okay? To get a lasting effect, though, we probably still need to look further or dig deeper, right? But usually what we'll say, to be fair to the body, most orthopedic injuries take 6 weeks to heal. If we really hit this nail on the head for adrenal recovery, it's going to be 30 days, okay? But if it doesn't change within 30 days, then we're missing something. Okay, so that's a great question, very fair question.